So with regards to winter ailments and the kind of things that we can expect to see during winter and the things that plague people commonly during winter, we range from things like bacterial and viral infections that tend to be more prevalent during the winter season. We have seasons for different viruses, particularly things like RS virus, which affects young children quite severely, are quite prevalent at this time of year, as well as a wide range of viruses and ailments that affect the upper respiratory tract, to pneumonias. Those are quite common during this time of year, and there are a few things that we can do to minimize our exposures to these things, as well as if we are indeed infected with these ailments, what we can do to treat them. Most of the common cold viruses will be treated symptomatically and be treated at home, and it's not necessarily that every person that gets infected with these types of things would need to go and see a doctor. As far as home remedies go, most of the treatments are directed at aiding the symptoms. So oftentimes paracetamol is used to treat fever and the pains that are commonly associated with these viral upper respiratory tract infections. Throat lozenges can be used to soothe the throat and to help with the irritation of the upper respiratory tract. Commonly nasal decongestants are available over the counter. However, it is important that if a person has vulnerabilities or other health issues, that they do consult their healthcare professional before they start just taking a whole wide range of medication. The other important thing is that a lot of medications tend to have ingredients that overlap. So it is important to not take medication and overdose on certain of the ingredients. For instance, commonly sinus medication will contain some form of paracetamol and sometimes even an anti-inflammatory, and then the cough medication that you take might also contain those medications. So it is important to just read the label, make sure that you're not taking the same thing twice. The question of immune boosters or vitamin supplements or that type of thing is quite a widely debated thing, and there's mixed evidence for vitamins. A lot of the time the vitamin supplements are going to be making your wallet lighter, less so than what it will be treating your infection. As far as the unresearched supplements go, the homeopathic supplements go, those are variable, and those are kind of based more on faith or belief than what they are based on scientific review. Immune boosting as a fad that has kind of come into the general public discussion is not really something that is viable or possible from a scientific point of view. Your immune system does what it needs to do, and it takes a certain time for it to become primed to fight infections. There's no physical or chemical substance that you can give your immune system to allow it to clear these viruses more effectively, and an overactive immune system is in itself a disease. It's an autoimmune disease, so we can't boost your immune system with an injection or with something to cause it to clear some of these viruses. However, as I said, there are treatments that will help ease your symptoms during these things. This is not, however, true for bacterial infections. For bacterial infections, commonly we prescribe certain antibiotics that are directed toward that specific bacteria that is likely to cause the infection, and the antibiotic then helps the body to clear the bacterial infection, and the same with fungal infections. As far as other winter ailments go that are non-infective, commonly people struggle with things that such as winter hands, and that is due to reduced blood circulation to the fingertips and to the toes in response to cold weather. It's caused by spasming of the arteries, and it is quite a common thing, although it can be associated with certain autoimmune conditions, and the medical term for this is called Raynaud's phenomenon. If Raynaud's phenomenon is severe, we do prescribe certain medications to help in treating it. Although there are over-the-counter preparations available that assist in just promoting the circulation to the fingertips, warming the fingertips as well is also quite useful for people who struggle with Raynaud's phenomenon. And there are some people that say that they benefit from using wintergreen ointment or salicylic based preparations. The other common winter ailments that people often struggle with, because they're dressed up quite warmly and they have a lot of layers, they tend to expose themselves to their own sweat a lot, and sometimes people can have flare-ups of eczema during winter. Again, with eczema, sometimes you can treat it with a over-the-counter preparation such as an emollient cream, which prevents the skin from drying out too much. And in the case of people that take very hot showers in winter, that's often the case. It can also worsen flare-ups of eczema.
3